All right, so why don't we get started? My name is John Kahler. I'm one of the co-founders of MedGlobal, and I want to thank you all for coming today for this webinar. The focus of this webinar will be both Moria Camp and refugees as it exists today, plus the COVID response being generated by MedGlobal and Kitrinos at Moria. As most of you know, MedGlobal is an international medically based humanitarian organization who serves the underserved and needy, be them refugees or internally displaced or just those that are affected by natural or man-made disasters. I want to thank you for coming today. In 2015, 2016, as the Syria crisis deepened, and those that didn't escape across borders that were now closed in Lebanon and Turkey realized that in order to leave Syria, they needed to somehow get to the Aegean. The overseas exodus began. Tens of thousands of people came across during that year. Their first port of stop was Mytilene. In Mytilene, their way station was Moria, but in those days, at the beginning of all this was a pretty easy transfer to from Mytilene to the mainland and then north. In 2016, those borders hardened. Easy access to Europe was closed, and the camp facility in 2016, those borders were closed, and easy access through Mytilene to the mainland to north was stopped, and the camps began to build up. It's a pleasure today to have Dr. Siyana Mahroof-Shaffi, who is truly the lioness of Mytilene, presenting today. She was there at the very beginning of this. She helped build this establishment. MedGlobal, Dr. Peter Houck and myself came to work for the first time in December of 2018. Camp at that time had about 8,000 people in it, and we thought that was very crowded. Estimates today are somewhere north of 22,000. Dr. Siyana has been there from the very beginning and has built a wonderful presence. MedGlobal, hopefully I've been a fruitful partner with them all through 2018, and hopefully we'll continue that relationship and expand as things go along. Abdulhadi Shahud, who is the clinical manager, anyone who's been there needs no introduction. Abdulhadi is the cog around which the wheel rotates. He's the grease that gets whatever's done. Whatever metaphor I can milk on this won't be enough to give him the compliments that he needs. And he and Siyana will be speaking about Moria, the current situation, as well as the projection for our COVID response. And third presenter will be Dr. Ameer Sharifzadeh, who was a volunteer there in March, which now seems to be forever ago. And in March, before all of this happened, the camp was still having problems because there was worries about the right-wing neo-fascist move on Mytilene. And Dr. Ameer was there during a recent attack and will speak to both the volunteer aspects as well as the aspects of that violent attack. So with that as an introduction, it's absolutely my pleasure to turn the camera over to Dr. Siyana Mahroof-Shaffi, who, as I said, has been there since the very beginning and can give the details that might be necessary. I think her son might be involved in the discussion also. Anyway, Siyana?
Thank you, John. So I think I can see there's about 40 people on here. Thank you very much for that warm welcome. I've never been called a lioness before, so That's a new one for me. I'm trying to figure out how that feels. Feminine, for at least you call me a lioness. Thank you very much for this opportunity as well to present. And I am working at home, so I will have interruptions with sleepy teenagers walking in. It is afternoon here, by the way. How do I have controls over the slides? Or do I have to say next to someone?
If you can just say next.
Okay, next, please. So I wanted to say something about the current situation. I wish there wasn't a current situation, because really and truly, I mean, when I went out there 5 years ago in 2015, I was meant to do like a 5-day volunteering session as a, on a medical mission as a first-time humanitarian in the field. And I didn't know what to expect. I certainly never expected to be here 5 years later. At that time, 5 days turned to 5 weeks, turned to 5 months. But to be here 5 years later, it is something really, really crazy. And we heard the figures, about 20,000 people or so. I think it's just under that. I mean, it depends which stats you follow, are living in the camp of Moria. There's about 25,000 people, refugees, I mean, in the whole of Lesvos. So there's 5,000 more dotted around other bits and pieces. Out of these, from our medical records, we actually identified extremely vulnerable people. Forgive me if my internet's a little bit unstable, but I will carry on for the moment unless I get stopped. Just on this figure here, I wanted you to, I think there's a way I can get a pointer. I'm not very good with Zoom. I'm a Google Hangouts kind of person normally, but this red area is the original detention center where people are housed. It was actually a high security prison. That was what it was built for on Lesvos, but now it's kind of housing families who have nowhere to go. And it was turned into this makeshift camp, because don't forget, most people who come to Greece are not stopping here. This was their entry point into Europe. And currently, this area here houses about 8,100 people. Its capacity is, I mean, if you're being generous, you would say 3,000. And the rest in this yellow big square outside here, these are all makeshift tents. Some of them will just have a bit of tarpaulin stuck between 2 trees, dotted all the way up there. You can see them. That's kind of got the rest of the people, so upwards of 18,000. Sorry, upwards of 10,000. I did my maths wrong there on the slide. We identified about 300 with pre-existing conditions. These are the people who in the West are being identified as needing shielding from COVID-19, and about 200 over the age of 60. So next, please. Next slide, Kate. Kat, sorry. So I did have, who are the people living in this camp? They are just ordinary people, families like yours and mine. They have, unfortunately, to queue up on this awful food line. That can be a video, but I don't think we will go into it unless we have time. And this picture on the right, which is a little bit blurry, was sent to me on WhatsApp just a week ago. So just to show you that, and there's kind of evidence that someone's worried about COVID-19 because they're wearing a little mask there. This was before our mask distribution. Next. So social distancing is basically a bit of an issue currently. Next slide, Kat. And of course, what does everybody, you type in COVID-19 and how you manage it. This is kind of just a screenshot of what you get. This is awful. I am really sorry to have to show you this, but on the other hand, this is what people are having to use. I've just had the latest statistics from the WASH team in Moria, and they are showing here, basically there's about 70 people per toilet because 16% of the chemical toilets are unusable, and the rest of the plum toilets, 86% of them are usable, but that's kind of the state of them. They have about 80 people have to share a shower. Can you imagine? I mean, we're all self-isolating at home in whatever countries we're in at the moment. And I mean, we have a family of 6 living in our house, which can be challenging. Yet it's like 3 of us per bathroom. Water points are very challenging because it's nice the way they put water points because they're not always just taps, they are just little drippy bits of piping, plumbing. And you know, there's frequent water shortages, the toilets have missing doors, and some of them, even though they're there, they're not actually working. Next slide. This is how kind of the tents are, you know, they're pretty ram-packed next to each other. A small tent like this could house a family of 6 easily. I think they're meant to be 2-person tents. The bigger ISA boxes have up to 15 persons in them, not necessarily all related, sometimes 2 or 3 families together. Next. And the other week, I think this was about 10 days ago, I saw this photo. This is actually a photo of Moria. And I think my heart just came into my mouth because I just thought, oh, here we are, it's beginning. It does confirm a case. It was the Financial Times. It confirmed a case of coronavirus. I believe there's about 12 or is it 20 cases in a camp called Ritsona camp in Athens, which is, so it's in the mainland and not on the island. So far, I want to pass over to Abdulhadi at some point. I think it's the next slide. Yeah, Abdulhadi can tell you about kind of what's going on the ground at the moment and the types of cases we're seeing.
So yes, from the clinic now, which now we are working still in Moria Camp, let's say, and the clinic is running Monday to Friday, 9 to 4, as a sharing shifts between the medical actors whom they stayed in the island and they still running their activities, but with, let's say, with minimum capacity. After March 1st, when we get attacked, or the medical actors get attacked, 35 medical members get attacked with their cars, and from that day it was, let's say, the beginning of losing our medical members regarding security issues, plus exiting the city by itself, which it wasn't for at least 2 weeks unsafe for the volunteers to walk and drive around the island. So from that day, we start, let's say, to minimize our capacity in the clinic between the medical actors. And from that time, let's say, clinic lost some of the shifts and some of the days. So for now, we are running just Monday to Friday, and we are running adult clinic in Moria and pediatric clinic as a shared shift between medical actors, Kitrinos and MSF. The number of patients get seen now in the clinic daily between 150 to 200 patients in the adult clinic and between 50 to 100 in the pediatric clinic. So for now, let's say no confirmed case in Moria so far, but in the island by itself, there is 6 confirmed cases, which it was from the Greek population. And for Greece in general, 2,192 cases, 102 deaths, and 1 death in the island so far. For the Moria by itself, for any test cases, let's say, there is 17 cases get tested 2 weeks ago during 1 month, and the 17, the results came as negative. For the island by itself, minimum 170 tests as well get done for the island by, let's say, the Greek population, and all of them get negative. So far, let's say we are in the green level of not get any confirmed case for Moria. But as everybody know, any one confirmed case will be happen in Moria, or any result will come as a positive. Immediately we have to suspect thousands. As soon as there is no ability to make sure everybody get isolated or everything will be done as soon as the food line, sometimes thousands or hundreds of people queue at the line. When you are telling the patients or the people, and when they're entering the clinic, please be sure you are washing your hands or you are not sharing anything with people. You are just telling them something impossible for them to do. First, if somebody on a group wants to wash his hand before eating, he needs to walk for at least 5 minutes for him and his children to go to wash their hands and be back to their tents to eat, and then walk another 5 minutes to wash after eating. Plus, when you are telling people also to don't stand next to each other, you are telling them to don't take the food from for their daily, let's say, basic, and you are asking them to just keep their children without food. So people to don't stand next to each other, it means they cannot stand at the food line, or they cannot stand at the line to go to the bathroom or to take a shower or to queue in anywhere in the camp. So it's just, we are talking about something impossible to do, but still education for the patients and let's say the medical service to keep running in Moria, it's have to be something without any question mark. But as soon as, let's say, all the NGOs are working together, minimum, let's say, members, but Moria 20,000 refugees living in. I mean, with 7,000 children as well, and around or approximately 1,000 unaccompanied minors. Still, EU watching Greece dealing with the crisis by itself since 2016, when the deal it get done between Turkey and Greece. And EU. All Europe now looking at Greece as there is no crisis there and there is nothing happening, which is unfair for all EU to just watch now and keep Greek people dealing with the crisis by themselves, and let's say close eyes, close mouth for social media for EU to just wake up, open their eyes and act to support Greece as much as they can and support the small NGOs whom they are holding the crisis next to the Greek government and the Greek population. I mean, I cannot imagine now 27 countries watching one small country dealing with all this crisis one by themselves.
Siyana, are you gonna pick back up? Are you? Siyana, was there more that you wanted to pick up, or how do you want to proceed?
Yeah, actually,
Sorry, apologies, I was muted. I'm unmuted. Thanks, Abdulhadi.
Okay.
Jazakallah khairan.
Thanks, Abba.
So, the thing, when you were talking about the EU deal in 2016, I just remembered that, of course, that was reversed sometime in March, wasn't it? So shortly after the attacks on the volunteers by the fascists on the 1st of March, there was also the Turkish people just saying, okay, guys, if the rest of the world not going to do anything, I'm just going to open the borders and I'll just let this be a free flow. And then thousands of people started to try and come again. And those awful scenes. I mean, March, I don't know, just seems like we've had such a terrible quarter. And there's scenes of people who are being pushed away, children being, it's almost like 2015 repeat. So anyway, thank you for talking about it. Just I thought it was really important to just note, I mean, even though Abdulhadi is saying that we have less capacity at the moment, we're actually seeing pretty much the same number of patients that we have been seeing for the last year to 18 months. Just the little point there is that the ITU capacity of Mytilene Hospital, the general hospital, the only hospital on the island, is 6 beds, but they have said to us verbally that they're able or prepared to extend that to 20. So shall we go to the next slide to look at what it would look like if, and possibly when, a single case is identified who happens to be living in the camp. I know I've got Chris Harkensey somewhere on the panel, but Chris, feel free to interject at any point. I don't know if that's possible on this webinar, as my internet does appear to be a bit unstable. But day 0 on this slide here will, and this, by the way, is without any intervention whatsoever. So we just let things be, as we showed you in the first 3 slides. Day 0 will be the first day a case is identified in the camp. And we then have to assume, like Abdulhadi says, that it won't just be one case, it will be at least the 15 people in their container or tent, plus those living within a few, less than a few meters, or less than a meter, I would say, around them, and the people who share their toilet, stroke shower, stroke bathroom, as well as the ones they stand in line to get food with. By day 14, so within 2 weeks, is when we would expect to be a sharp rise in the number of cases. And of course, you see the acceleration. Now, some of this modeling was done based on the figures we have had from the cruise ship. Is it Diana, Princess? I forget the name of the ship actually, but the cruise ship, the kind of the way the infection spread in close quarters, we've used some of that information to build this modeling. And within 3 weeks, we could expect in the region of 8,000 to 9,000 infected patients. The red line on this one just shows, out of interest, the number of severe cases that we would expect hospitalization, which means at least a couple of thousand. And remember, my previous slide said they have a capacity to increase ITU beds to 20. So these numbers are really impossible to digest. And next slide, please.
Sorry, if I may just chip in for a moment. What this slide shows is, sorry, can we go back? Yeah, thank you. It's actually not the number of infected people, it is the number of symptomatic people. Yeah? So these are the ones who actually show symptoms. And by the time we see a rise in cases, so meaning more patients presenting to the clinic with symptoms, around day 14, already more than half of the camp population is infected. Yeah? And what we see there around day 21 is meaning almost everyone is infected. And whereas in countries like the US or UK, where we expect an infection rate of probably at some point 60% of people being infected, we can say in Moria, almost everyone within 3 weeks will be infected and will become symptomatic. And if you just look at the numbers, you can pick any day. If you look at day 21, you have more than 8,000 people with symptoms. And then a week later, you have 2,000 who need hospitalization. Yeah. So that is something that no healthcare system on the island would be able to cope with.
Thank you, Chris, for that. And in fact, the next slide is a quote from Chris, because he's on call as an infectious diseases consultant for pediatrics here in the UK, in the Midlands. And thank you for taking time out of your on-call to talk with us today. And so that just summarizes that, you know, within 10 days, and I think that is an important point you make, that just because they're not symptomatic doesn't mean that they're not infected. And for any intervention, and this is the key part of what Chris was trying to say, I suppose, here in this slide, is that for any intervention to work, we're working against the clock here, but we have to implement them before the infection hits the camp. Every morning I wake up and I have no news. It really is good news. Next slide. So what assumptions and interventions do we need to do here? One of the most important things which we've been working at for the best part of the last 3 weeks is to identify and evacuate those 500 at least people who, through our clinic records, we've proven have got a genuine need. It's still taken 3 weeks, and I think so far, Abdulhadi, correct me if I'm wrong, I believe there's been about 250 or maybe a little bit more than that have been removed. But the good thing that UNHCR have done is that they have listened to us. So I've shown them this presentation, and they've actually now taking not just the family, the vulnerable people, sorry, but they're also taking their families, which means the families can stay together. And they're being put, some into hotels across in the mainland in Athens, and some I believe the hotel owners have finally given in and given permission for their rooms to be used for this purpose. There's something called sectoring that we want to propose, which is basically, again, like Abdulhadi says, all these things we're sort of talking here, and to actually implement them is another thing. But we want to try and divide the camps so that we can separate people into, well, if you look at the little box at the top in this graph here, you'll see that at least 4 sectors will give you this. So these now are demonstrating some intervention. There's your baseline in the blue. The red will just show a lockdown. So I'll talk about the lockdown first. Lockdown is basically trying to control people to live within 5 meters from their tents. We know it's impossible to say to them, stay at home, because they don't have a home. And besides which, how are you going to hold 3-4 kids inside one tent? So 5 meters was what kind of was allowed for the modeling, that they're going to be wandering around within 5 meters, hopefully remaining slightly socially distant from others. But of course, they need to get to the toilet and possibly still get their food if the 3rd intervention or the 4th one isn't followed. But just by doing the transmission control, which is encouraging the washings of hands, I mean, we actually, Abdulhadi with his own hands built an extra sink or 2 in our clinic, just because we wanted to make sure that when they came to see us, we could offer them that service. And that takes it down immediately from that peak there to that peak there, and the lockdown. So once we add the sectoring, now depending on the numbers of sectors, 4 sectors, could divide the camp into 4 potentially, we're making some difference. You see some remarkable drops in terms of flattening the curve. And the final, if we can really, I mean, and we're working on this final one first and foremost, actually, is to see if we can get rid of that food line, the queue of people standing there. That's the only way they can pick up their food 3 times a day. And if we can add that to those other measures, I say things are a little bit better, but let's just look at this flattened curve in Moria, what it actually means. It means that we drop the curve so that we don't have like several thousand, maybe 8,000 sick people, to maybe about just under 1,000 there. It is going to prolong the presence of the illness in the camp, which means that, you know, there's going to be quite a lot of activity for us on the ground in terms of taking care of them, at least 4 to 6 months potentially we need to prepare to provide services for. It will mean as well, obviously, the number of people needing hospitalization will go down, but this y-axis here is still showing thousands of people infected. And bearing in mind our current capacity is 200, 250 a day, we're going to need to do additional things. We're going to have to do something more. Next. I think that's another. So this should just reiterates the flattening of the curve. what we can achieve by doing what we do. And I think here this particular slide also allows, correct me if I'm wrong, Chris, here, but we know that people are not going to stick to the 5 meter rule. So we're allowed on the yellow line, we're allowing up to 2.5% to break that rule. And on the green one, hardly anyone breaks that rule. And in addition to all of this,
was slightly different. So the orange curve shows removing all the kind of centralized lines like the food line. And that actually already draws a little tail of kind of sectoring, because food distribution, toilets would then be within sectors. What these other 3 lines show is the likelihood of becoming infected on visiting the toilet. So if we can implement measures such as distancing in the queue, hand washing before going into the toilet, hand washing when coming out, and basically when it says 2.5%, that's your chance of becoming infected when you go to the toilet. And if we can reduce that with these hygiene measures, again, and this is in addition to removing these central lines, that has quite a substantial impact. So what this graph shows is that a simple measure like that, which would be around an education campaign and providing some simple facilities, such as 2 meter markings in the queue and hand washing facilities in front of the toilets, that could substantially slow down the spread of infection.
Thank you, Chris. I mean, the bottom line is that we're not asking for impossible things, okay? The first thing we ask for, all the people shouldn't be living in Moria. They should be removed from Moria. Of course, that fell onto deaf ears and is clearly not going to happen. So we're having some luck with 250 people being moved. Next slide, please. Yeah, so I have to say, none of this modelling was my own work. It was thanks to some really good friends of Chris, actually. Chris has contacts in the University of Manchester and for the Centre of Crisis Studies and Mitigation, so they were perfect. We're very grateful to Tucker in particular, who did a lot of this work and continues to do so as he works with the UNHCR team to help implement this and also have those important conversations with the government. Next. So we have done some work. I mean, we've managed with our friends in Team Humanity to make some masks, homemade masks, and distribute these to the community. Is what I didn't say was that majority of the cases who come to the clinic, I think about 80% already have respiratory infections. So they're already coughing, sneezing, spluttering. And we thought, you know what, okay, sure, maybe the homemade masks are not going to be your FP93 grade or whatever, but at least we can stop them. I mean, I know when I've been self-isolating with a cough at home, it's almost impossible to grab a tissue in time. So the people are so amazing. They're actually wearing them, next slide, and giving them to their children. The Team Humanity crew have taken it upon themselves to try and do a bit of cleaning internally. Yes, there are organizations who are meant to be doing this, but as you can imagine, working in a camp which is 600% over capacity, it's not always going to get done unless you do it yourself. So here's our cleaning busters team. Next. And I think that sort of just gives you a nice overview of Moria, but that is probably the end of our slides, is it, Kat? I know you're putting all this into one presentation, but if I haven't answered anything clearly enough, I think one thing I do want to say is that in order to take care of all these people, yes, a lot of the comment on the ground is the government has been given EU money to sort this problem out. But the reality is, and this is the reality of why I'm still there, is that it takes time and initiative to translate funds that come from big organizations to big bank accounts to big people in the country. And sometimes it just needs small people like me, you, anybody else is interested to make the real differences on the ground. So we're very grassroots. We've just responded, grown to the challenge that we saw and observed. And I think at this moment in time, we are getting together to try and build ourselves some Nightingale units. They're going to be dotted all around in local warehouses, and we're working very closely with MSF and UNHCR to make sure we can get all the due diligence done. But ultimately, it will be down to us and our small team on the ground to actually take care of people when they become sick and take care of each other. Because one of the most painful truths that I heard recently is that actually if COVID-19 hits these refugee camps and the problem is forgotten or not known about, for example, they just quarantine them, lock the doors, and kind of out of sight, out of mind. My personal fear is that there could be, I don't want to even say this word, but there could be another Holocaust in Europe.
Thank you, Siyana.
That's really all I.
Thank you so much. Thank you, Siyana. Thank you, Abdulhadi, and thank you, Chris.
Yeah.
Thank you, Chris, for coming in.
Thank you.
Look at this picture as Ameer picks this up. But take a second to digest this picture, and then think of the very, very simple requests of primary preventive services that the three of them were talking about. Think about the reality of it. I'd like to introduce Dr. Ameer Sharifzadeh, who is a MedGlobal MedGlobal volunteer at the camp in early March, before COVID, but at the zenith of the right-wing reaction. And Ameer was involved in the violent attack on volunteers that Abdulhadi made reference to. Ameer?
Yeah, so for anybody who's just tuning in, again, I'm Ameer Sharifzadeh. I'm an emergency medicine doctor out in Chicago, here at our kind of major public hospital for the city. About a month and a half ago, I was out in Greece working with MedGlobal and Kitrinos at the clinic out there at Moria Camp. I'd done some work with refugees in East Africa, but never as a physician. It was my first time actually going providing medical care as a physician. So I was pretty excited. When you first arrive at Moria Camp, it's pretty evident it was never intended to hold the number of people it contains. When I was there, it was there were more than 20,000 refugees at a camp that was really only intended to fit about 3,000 people or so. You can see that there's like Dr. Siyana said, it was a former detention center. You can see that there was barbed wire over the fences, and the unhygienic conditions were pretty evident. Before the attack started, I fortunately was able to volunteer at the clinic. A few things that, just some of the positives I wanted to mention. I thought, shout out to Abdulhadi, Dr. Siyana, the MedGlobal team, all the other volunteers. I thought it was a really well-ran clinic. It was very efficient. You could tell they really did the best with, what they had available. And I loved how they actually involved refugees in the clinic. My translator was actually a refugee, and this kind of hit home for me. Just one of the main stories I heard was actually from my translator, who actually was a doctor in Afghanistan, and but hadn't practiced from maybe 7 to 10 years because he had to flee from the Taliban, who threatened his life and even cut off a part of his finger. And so, again, the work that's being done there was fantastic. We saw about maybe 20 to 30 patients. It was me and the translator. We saw 20 to 30 patients that first day, which unfortunately, ended up being my only day working at the camp. Unfortunately, animosity had been growing on the island from right-wing groups on the island towards the refugees and literally anyone helping the refugees, to the point where when we were leaving the camp in a convoy of 8 cars, after my first day at the clinic, we were attacked by violent right-wing groups. A roadblock was formed by a massive group of people on foot, motorbikes, and pickup trucks, holding clubs, baseball bats, and chains. They yelled at us to turn around, and in the midst of turning around, began actually smashing our windows, including the back seat of our car. If you look at that red car, I was actually sitting in the back seat. They kind of smashed that, and the baseball bat coming within less than a foot of my head was it was pretty terrifying. And we fled, and ironically the safest place for us was actually back at the refugee camp, and that's where we fled. The refugees, again, you can sense how much how well accepted at the clinic, and all its volunteers were accepted by the local refugees, and they accepted us. They were very welcoming, brought us even falafel sandwiches and warm blankets while we awaited things to calm down. And we finally escaped in the middle of the night to return back to the city where most of us were staying. So unfortunately, we were not the only ones attacked. Other aid workers, journalists, and refugees, of course, were attacked. And unfortunately, the next day, the violence, intimidation, and fear tactics continued. So I, like others, evacuated from the island. I think for those who haven't been to the Lesvos recently or haven't read about the situation, through the media, it's really important to understand that the tension is very high. The people of the island just a few years ago, received a lot of international attention for welcoming refugees, but really due to, I think, the failures of, the international community in Greece to help kind of alleviate the pressure placed on the locals that they're having to, support an ever-growing number of refugees. There's been growing frustration among the locals, feeling like they've been kind of left to deal with the situation alone, such that, I feel like right-wing extremist groups in Greece are kind of preying on that frustration and, making, which, kind of makes the locals susceptible to their right-wing messaging. So, I salute, Abdulhadi, Dr. Siyana, MedGlobal, Kitrinos, and all the other volunteers out there. Back in Chicago, dealing with COVID, our hospitals are running into the issue of not having enough PPE. And, this is an issue all throughout the U.S., and I can only imagine the issues with not only getting appropriate PPE for healthcare workers at the clinic in Lesvos, but also, how impossible it would be to advise patients on social distancing, hand washing, as Dr. Siyana already mentioned, or, presentation, making that, a difficult situation already even more difficult. And the fact that there's, and something that might not have been mentioned, I'm not sure, but there's kind of one hospital on the island. I work at a hospital in Chicago, and, we're already basically at capacity, and having to imagine, that hospital to take care of, the patients, that are non-refugees, but also this plethora of new potential patients, for a healthcare system that wasn't designed to carry so many people. And then you have the issue of, increasing tension among the Greeks, towards the refugees. So, it's a very challenging situation. I really salute all of you guys, what you're doing, Dr. Siyana, Abdulhadi, MedGlobal, Kitrinos, and thanks for having me on, John.
Okay, yeah, you're welcome. Thank you so much. I also want to mention to the audience that Ameer, like others among our group, left the island, but Ameer said, where else can I go? I've got the time, I came over to help, where else can I go? So instead of going home, Ameer actually went to Turkey, and then went back down to the Greek-Turkish border on the Turkish side to look at the situation and help MedGlobal make some decisions about work. One other thing I'd like to do before I open it to questions and answers is, Abdulhadi, did you have something else that you wanted to contribute? I apologize if I cut you off.
No worries. Thank you very much. Really, thank you, everybody. I would like just to share the last message from the ground, as I am now talking, let's say, from Moria Clinic now. So on behalf of Moria by itself, on behalf of 20,000 refugees living in Moria, on behalf of the doctors, nurses, paramedics, heroes, translators, workers, non-medical volunteers, we are here doing our best. We are here for the people, but we are not enough. Everything we are doing, it's not enough. The last message from all of us here is, EU, where are you? This message, it's written in all over Moria Camp, written in the city center of Mytilene, asking EU to evacuate everybody. Whatever we will do, whatever we are providing, we are doing our best, but we are not enough. As soon as EU will act, EU will take action, EU will support everybody in the ground and support these people to have a future, to have hope again, and to build their own future inside EU. Thank you very much, everyone.
Thank you so much, Abdulhadi. I really appreciate it. If there are questions, please type them into the chat box or the Q&A box. Chris, did you want to add anything at this moment in time? Chris Harkitsy is a colleague of ours. He and I worked together in the Bekaa Valley a couple of years ago. Chris came over. He's an infectious disease specialist in the UK. I know he has to be front and center on the COVID response in his region. Did you have anything else you wanted to add, Chris, right now?
Yeah, I think I just wanted to add the thanks to the group in Manchester who did this incredible modeling of a disease outbreak, which I think is not relevant only for Moria. You can extrapolate that to any other camp on the Greek islands. And I can only underline really what Abdulhadi said about decisions need to be made well beyond the local level. And it is on the EU, it is on the Greek government as well to take action to avoid humanitarian catastrophe, really. And I know that Siyana, and I was in one of these talks as well, we have tried to speak to the Greek authorities and push with UNHCR to use their influence to make some progress there. And I think the next big step really is that we want to shut down this central queuing for food, which is one of the major drivers of a potential outbreak, because everyone converges there and then goes out to the periphery of the camp again. So we'll basically carry the virus everywhere very quickly. And that would be a simple measure that could be hugely effective, but it's controlled by, I think, the Greek army or the police, and only massive pressure beyond the local level, I think, really has a chance of success there.
All right, thank you so much, Chris. I really appreciate it. Let me lump together a couple of the questions that have come from the audience. First and foremost, there's a question of testing. Are there tests available in the camp at this moment? Have there been tests that have been obtained? Either Abdulhadi or Dr. Siyana, anybody? Are there tests available, or now, or in the near future?
Yes, I mean, if we are facing any suspected case now, we have to send to Kalbno, which is EUD, the Greek Health Authority, let's say, in Moria, for them to send to the hospital and the patients to get tested. But so far, 17 cases get tested, and all of them negative.
But there's no general case testing. There's no screenings other than, I assume there's fever testing, but I mean, there is no point of care. I mean, there's no testing, nasopharyngeal testing, general widespread testing in the camp.
No.
Is there testing of volunteers who come in, or of
Yes.
the police and the medical personnel? There are.
Yeah, the volunteers, every volunteer or everybody will enter the country, will get tested in Athens, and will be in quarantine for 2 days for the result to come out. Then, if it will be negative, the person allowed to travel again or to enter any island if he really needed there. Or if it will be positive, have to be quarantined for 14 days, and then will be checked again in the hospital for any.
Okay, thank you. There was also a question from a colleague. Go ahead, Siyana, I'm sorry.
Yeah, so I was just going to say, I think the Greek system is actually, they're doing very well in terms of contact tracing and isolating for the general population and in terms of controlling the spread across the country. But there's no testing available at the camp. There's no point of care testing on site.
Thank you,
And
Siyana.
if
Thank
I
you so
could
much.
add to that, testing would only make sense if it would be fast,
Right.
and if we would have facilities to actually isolate positive people. And I know that, Siyana, there are thoughts about building facilities where we can potentially isolate positive people and possible contacts as well.
Yeah.
Go ahead, Abdulhadi.
Yeah, regarding the update from the ground now, which I keep it till I answer the questions, but I can share now with you guys. The isolation center also will be created in the beginning of May. Also, the central triage will also set up in maximum 10 to 14 days regarding, let's say, preparation for coronavirus for Moria Camp.
That leads into a question, and that leads into several questions actually about budgeting and that. Those are plans that have been budgeted and are on the road to completion, or those are plans that are still in the planning phase and waiting for budgeting?
No, actually everything it's have been done. I mean, yesterday it was the final meeting regarding that, and now all the NGOs put their hands together to go with this plan.
Well, their hands together have always been there. Have they put their wallets together? I think is the real is the real question. There's several questions on the from the participants about staffing. First of all, how many doctors and nurses are there at the moment, and as the plan evolves, what are the staffing plans?
So for right now, what do we have? We have 5 doctors in the clinic, 7 nurses. For Moria clinic camp, let's say, we have also 2 doctors supporting MSF pediatric clinic for the green cases, and the plan for the future, it will be 3 doctors for Moria clinic, 3 nurses, and for the unaccompanied minors clinic, 1 doctor, 2 nurses. For Kelbno emergency shifts, the plan for them also 3 doctors and 6 nurses. Central triage, 6 doctors, 6 nurses per shift if it will go from 8 to 4. And also for the isolation place, they will be 5 doctors and 10 nurses.
So you're up to 30 nurses in that plan. Where are those nurses going to come from? Are they going to be on a volunteer basis, given that the problems of volunteering for the next 6 months in and out from Europe and the United States? Are there plans, are these to be employees or are these to be volunteers on a shorter or long-term basis? What is the staffing plan?
So there will be both, I mean, international and local, let's say. And we are, let's say, have opening letter now calling for volunteers, which some respond for it. And we are waiting for more and more and more.
So what are the...
I want to add.
Go ahead. Go ahead.
Yeah,
Sam.
I want to add that I think at this stage in time, it is very difficult to rely on short-term volunteers. So, and I think if anybody needs to be spending 6 to 12 weeks upwards in one place, we are trying to source funding to support people to do that. We've certainly got space for people to live in. We can provide transportation. We're just now trying to put together a budget to actually support people. I know how difficult it was when I went to volunteer for 3 months the first time, and you know, not everybody has savings to live off. So just understand that these people normally, they come over and over again, self-funding. And what we need now is, as the rest of the world, okay, our governments are a bit rubbish. Let's put ourselves together. I think MSF, we're talking to MSF, we're a big organization, we might be able to get, but we're trying to coordinate some sort of response whereby we can support these guys financially. So sorry, I interrupted you.
No, that's perfectly fine. There was a question about raised about Karatepe. Karatepe is a smaller camp, 3 or 4 kilometers from Kitrinos. Does anybody know the status of Karatepe?
So yeah, Karatepe get managed by MDM, which they are Greek French medical NGO running the health system for Karatepe Monday to Friday, and it seems they are doing well, but still also over capacity, at least 200% than how it should be.
They're at 200%, is it? Okay.
It seems like that, yeah.
All right, well, our time is
And
coming to a close.
there's plans to close it down. Oh, sorry. Yeah, they're
No,
going to
please.
close Karatepe down, and so they're not allowing any of the empty containers to be used currently.
Oh, really?
Unfortunately.
They moving the people, or just are they going to just close it by as people leave?
I think the plan they have, it's all such a mess, isn't it? They were building things everywhere else. They're all half built, and anyway, it's such a mess. It's as clear as mud, as they say.
All right, it's time for us to begin to wrap up, but we'll do that, and I'll ask you a question that is a summary of a couple of questions that have come through, and it says, what type of advocacy, what are a couple specific recommendations that you all would have with regards to advocacy questions, advocacy issues that we can take to our local governments? Let me add two things to that before I turn it over. The first is we got a big virtual hug from Spain. And the second is that people are very, very thankful to the work being done on the ground, as am I. So let's go out with a couple of questions. I mean, I'll ask everybody to weigh in about, now that COVID has taken the air out of everybody else's sails, what type of things can we do to keep the plight of the refugees in Moria front and center here in the States and Europe and wherever? Siyana?
Well, I mean, I've written a public letter about this probably like 6 weeks ago now, I can't remember, but I think everyone, the world, not just Europe, the world, we're a big space world. Yeah. We can take responsibility for this, okay? It is not like, we're not talking about millions of people. Millions of people are in camps in Lebanon, in Turkey, but we're talking about, some less than 100,000 right now. And they are in Europe. They're in the West, technically speaking. So we, the world, should be taking responsibility for this. Of course, asking for that to happen at a time when we're all kind of covering our own backs and watching our own backs. But I don't know, the optimist in me would like to believe that as we, including our Prime Minister and Prince Charles, get unwell and they enter our hospital systems and they look around them and they visualize and see who's caring for them, maybe this is actually the time to do this. So us in positions like in medical professionals, nursing professionals, healthcare professionals, any capacity, key workers, okay, you guys, you know who you are, we know who we are, they know what we look like, we know what we look like. Okay, let's just drop this issue, and maybe this is the time to stand up and rise and say, guys, there is something that really is important to me. Okay, don't just clap for me every Thursday. Do some other stuff for me. Okay, give us some full-time work here and take care of our brothers and sisters. That we got some people here that we're concerned about, and I think the thing is to do the talking, to say something, and definitely do not do nothing. If I said that right.
Thank you, Siyana. So you're both a lioness and an optimist. I like that. What a combo. Siyana, I'm sorry, Abdulhadi?
Yeah, actually everybody in Moria just, let's say, left alone, let's say, from the rest of EU, which these people, of course, they didn't came to Europe to stay in small tents and waiting their tents to be burned of electricity or of mass of electricity or watching their children under the rain. These people came really to be educated, for them to active, for them to, let's say, build. But what we can say now regarding Corona, support the medical side as much as you can. And for our dear doctors around the world, just please try to come and put your hand with us for us to keep supporting whom they are in need.
Thank you so much, Abdulhadi, as always. Thank you. Amir?
Yeah, so I echo everything that Dr. Siyana and Abdulhadi said. You know, absolutely, our governments all over the world need to certainly step up and one, help evacuate the camps. I mean, there's way too many people there. The island just can't deal with that, regardless of, you know, fantastic all the intervention plans. But I mean, number one, evacuate. And then, you know, two, you know, at least more locally in terms of the American government, we have to take more refugees. We're not taking enough. And, you know, there's a number of different, you know, refugees at that camp. But I think one that I think is probably the most embarrassing from our government is the fact that, you know, there are Afghani translators who actually worked for the American military who are still there, who are offered, you know, protection back in the U.S. if they helped out our military, and then their backs were turned. We turned our backs on them, and so we need to do more. The global community needs to do more, and we got to evacuate Moria.
Thank you so much, Amir. Chris, if you're still on?
Yes, I'm still here, and I think what I would like to add, really look at the local level, everyone who is listening here, and see what can you do. What I mean, for example, is contacting your local member of parliament or member of European Parliament and lobby hard with them to make their influence count in Brussels or, you know, in your national country, to push really for European governments to do more. It's really appalling that the response to the Moria crisis was that they would evacuate a small number of unaccompanied minors, which are not even the highest risk group for COVID. It really has to be more, and it has to be focusing on the groups who are at highest risk for that. And I have started that. I've written to my local member of parliament here in Newcastle and asked them to influence with the government in the UK. Sadly, I don't have a member of European Parliament anymore because of Brexit, but people who live in other European countries, I think that would be their call, really push them hard.
All right, thank you so much, Chris. Things are going to, so COVID has taken the wind out of all of our sails, but we can't forget what was going on prior to COVID. And that was a real hardening of borders, a real closed down and negative refugee work. This is only, there's no question that's going to get worse, because when the borders open back up, now the refugees will be seen as carriers of disease. This says old history. Pick up Camus and read The Plague if you'd like to see a very well written description of all of this. So let me also say that to help, MedGlobal plans to stay for the long haul in Greece. Please go, if you can, to www.medglobal.org. Contribute to the Greek project. The monies will go to helping the COVID response. I see a lot of stuff going through chat here. Is there something you want to say, Siyana, that I'm missing? I apologize. Oh no, I see there's a discussion going. All right, so anyway, so please help us if you can. As everyone has said, this is still this is a very, very difficult issue. This will complete the webinar for this week. Next week's webinar is going to be about our project in Bangladesh. Similar, but on a much larger scale, where we have 22,000 patients in Moria. There are close to 750,000 patients in various camps locked down in Bangladesh. So let me take this moment to thank everybody. Let me thank the participants for their time and energy. Let me thank all those who attended. And I look forward to working with, to seeing you all again and talking to you as soon as I can. Thank you so much.
So,
Thank you very much.